Hi, my name is Evan Bradley. I'm a director and consulting actuary at 3-1 Consulting Actuaries. I've been involved in the healthcare industry for approximately 10 years. I'm going to be giving a short talk around the potential impact of introducing low-cost benefit options into the medical scheme environment. One of the hot topics in the South African healthcare sector recently has been the potential introduction of low-cost benefit options into the medical scheme sector, which would provide for more affordable cover that is primary care focused, which would allow for more potential members to join the medical scheme environment that have currently been excluded to date due to affordability concerns. These primary care products have been provided through the health insurance sector for a number of years and have been growing in popularity as the cost of medical scheme cover continues to rise. However, there has been a concern regarding the demarcation of these products relative to medical scheme products and the potential for these products to siphon young and healthy members out of the medical scheme risk pool and drive up costs within the medical scheme context. As a result, the Council for Medical Schemes is in the process of developing a low-cost benefit option framework for introduction into the medical scheme environment. As 3-1, we've assisted the Free Market Foundation in assessing the potential impact of the introduction of these low-cost benefit options into the medical scheme environment, focusing on two key aspects and potential outcomes. Firstly, we've considered the potential financial impact on the medical scheme industry, and secondly, given that these products are expected to be introduced with a maximum income threshold, we have considered the potential for a group that might be excluded who fall above this income threshold but yet still are unable to afford current medical scheme products. Based on our analysis of the country's income profile, we have calculated that this potential excluded group may represent between 130,000 to as much as 1 million lives or more, depending on where the income threshold is defined. This talks to an important balancing act in setting and defining this income threshold, because it also has to be weighed against the potential financial impact on the scheme industry. The higher we set the threshold, the fewer will be excluded from private healthcare cover, but the higher we set the threshold, the more the potential financial impact and financial loss on the medical scheme environment. This financial loss is driven in large part by the cost of buy-downs of members from current medical scheme options, where we expect that potentially sicker members will remain on these current medical scheme options and claim a lot on the current defined set of prescribed minimum benefits, and we would lose the cross-subsidy of healthy members buying down to the low-cost benefit option. Based on our analysis and high-level analysis to date, we have calculated that at an income threshold level of approximately 15,000 Rand a month, we may see as much as a 1 billion Rand financial loss impact on the medical scheme environment as a result of these buy-downs. Should we set the income threshold at a lower level of about 6,000 Rand, this financial loss might be eradicated, but again, this would drive a large group of members that would be excluded from the medical scheme environment, given that they have income levels above 6,000 Rand a month, but in fact are unable to afford current medical scheme products. Our analysis to date has highlighted some of the key risks and dynamics that should be considered going forward in developing the low-cost benefit option framework. That being said, there are a lot of key additional areas of information that can be further unpacked to improve our understanding of the potential impact of the introduction of these options. As an example, these options currently exist within a very different regulatory framework. Introducing them into the medical scheme environment may have potential impacts on the cost and value of these products relative to them being provided in their current insurance context. We are also not sure how it might potentially impact the benefit design of current low-cost options within the medical scheme framework, which may influence the potential financial impact on the industry. We look forward to seeing how this progresses and being involved in the decision-making process going forward.